marketing and way I spent money, the way I was doing things. I basically over the last month redesigned all these different scenarios, because as I start to test the market and try to get my confidence back, because we all had confidence, even if we weren't marketing a lot, there was at least some confidence that if we put something out there, that there was going to be something coming back. And now we live in an economy, in a society where there's so many uncertainties. My biggest thing is there's lots of fear out there, and it's a biggest barrier. It's always been there. It's always, fear has always been a big issue in selling anything, not even if it's dentistry or whatever. But the big difference now is that everybody has this huge, thick shield up because they're worried and they're scared and they're fearful. And so I feel like going back to basics, like you said, to me, is understanding my patient, like starting there, like truly, like one of the things I think that we're really good at in my office is that we are just really, really critical on making sure you write down every question people have. And then those are the type of questions we actually answer in YouTube videos and on Facebook. And so if you really care about your patient, like, so my big thing is understanding your patient now. Like a month ago was one thing, right? Now it's like, what are their fears? What are they experiencing on a daily basis? Like for me, I don't do general dentistry. So I still have to shoot, I have to still hit for the fences. And I still believe, I really believe that there are people out there that are going to still need it. For sure. But the way I communicate with them, I've got to understand them. And so how I do it is, you know, one of my tips is that it's like, okay, when someone comes in and they say, I want a new smile. Okay, it's understanding them to a point where, is it really the smile that they want? Or is it the emotion behind the smile? And why is it they want? So for example, if I was like, hey, John, why are you here in my office? You'd say, you know what? You're an idiot, right? Look, my smile, it's not great. Patients say this all the time to me. But then it's going the next level deeper and saying, tell me more about that. How is that showing up in your life? It's so hard as dentists to do this, but if we don't take the time to understand them, and it's like, so one of my tips and tricks is this, is I try to find something like, imagine like what's happening in their life right now. You know, I think of like this woman waking up next to her husband, and she rolls over and she goes to kiss her husband, and for one reason or another, he pulls away. And that moment of complete insecurity, now it could have been that he was just in a rush, he didn't notice. There's a million reasons why a man might just not be completely present. But to that moment, that woman, she thinks, oh, it's because of my smile or my breath. He doesn't love me, and this is killing my marriage. You know, and so when I think about my marketing campaigns and the messages I'm doing, I'm thinking about how it's playing out in the daily lives of the patients. I think we got to do better at that. Anyways.
Yeah, I think it's I love that you say that about like really listening to your patient. You know, I had a consult the other day, and for the first time in a really long time, I actually took the time. I, myself, as the doctor, took the time to listen to him, to really listen, not to hear him, but to actually listen to him and to have a conversation, right? A dialogue with them, as opposed to a monotonous, you need this, you're going to get this, it's going to cost this much, it's going to take this long, sign on the dotted line, make your appointment. Mm-hmm. And when we're so busy, or we're like, well, I'm busy, you want to come here, come, you don't want to come here, don't come, I got a hygiene check I need to do, or I got this crown prep that I have to do, or I have this hybrid case I need to do, like, I'm busy, like, I don't need this in my life. But what's going to happen is the patients they still want to do it because they still have a problem. It's not that the problem's going to go away because we're in quarantine. They still need it. But what they're doing now is they're putting up, just like we are, which is insane, barriers with our PPE, with our fiberglass, with our locking of the door, with the no waiting room, with staying in your car. We're putting more barriers than ever to see us. They're putting up barriers in terms of why they think that they no longer deserve this treatment. And all they deserve is to have broken teeth, to have dentures, to not be able to order whatever they want on a menu, to be able to say, I don't deserve to spend X amount of money on myself, but I'm going to spend it on my husband or my wife or my kids, but I will no longer spend the money on me because I've been like this for so long. And then when they say that to themselves, for us to break through that really takes, there's the opening is there. They give you the opening, but they shut it closed real fast. You need to get in there to really listen to them, to what they're saying, or even more so, I tell my team all the time, listen to what they're not telling you. When they're telling you they have college to pay, right? Or I have to ask my wife, or I'll let you know, it's because you did not address what was bothering them, or you did not address what was blocking them from saying, hey, I want to make an appointment. Because when they make the appointment, people say all the time, I get bullshit callers. People call me, it's fake. Dude, they picked up the phone, they dialed your 7 digits. There's a reason they called. Sorry.
You know, man, dude, and I love it. I love that passion, brother. Because that's it. I tell my team, this is something I tell them all the time. It goes right along with what you're saying is, I feel like there's really 5 questions that a person has to have answered to move forward. And
we write this down.
Yeah, man, these are the 5 things that I feel like. So the first thing is, am I safe? Meaning, do they feel safe in your office? Meaning emotionally. Right now it's physically too, but like, do they feel judged? Do they feel like, to me, like one of the things I love that I get all the time is like, Dr. Hendricks, when I came in here, I just felt like you just truly cared and your staff really cared. Like that's the first thing. So feeling safe. And I think right now with all the fear out there, so if we're not, here's my thing too, is I feel like the only way I can connect with other people is if I can be connected to myself. I know that sounds deep and it's all Tony Robbins and stuff, but let me explain it. I believe that you connect with someone when you found a way to own who you are and be congruent, right? If you're like reading a book and saying, okay, this is the way that you should be talking to people, even if it's like these techniques to how to sell. But if John doesn't come out, like how, the quirky John, the John that's like 5 years old, the guy that like had no, like he was out, loving on people when he was 5. He was solving world problems at 5. Like that little boy needs to connect with the little boy or girl in that room. And that's the safety thing, because children have this innate sense of knowing if they're safe or not. The second thing is you have to answer this question. That is, do you know me? In other words, like do you know me? Am I understood? So often we're like, you have a problem, here's the solution, take care. And a lot of people just want to be heard. And so it's so hard sometimes because we're so busy, but just sitting there and letting them go and actually just not zoning out and actually trying to be present. Because at a certain point, I tell everyone, at a certain point, everyone stops talking. They have to take a breath. And once they stop talking, then they're going to think, gosh, I think he knows me now. He understands me. And then the third thing is, am I important to them? Like what's it about me? We all want to feel important. We want to feel significant. So one of the things I'm passionate about is when you walk into a patient, and I think this is the same thing whether you're seeing them virtually, because we're doing a lot of virtual consultations now too. It's trying to find something that you can like about them. Like authentically, when I walk in a room, it's like, if I can't find one thing I can like about them, I'm just not going to take them. But it's like, if they're feisty, it's like, hey, you know what? You're feisty. I am too. Shut the hell up. And then we'll laugh about it. It's like, oh, okay, now we're the same person. But I always just try to find something that I can authentically say, I like you for that reason. And usually I can find something, and that's a big connection. So when someone knows that you're important to them and you like them, because someone, I'm talking too much, so I'll be quiet. But one of these things is that people don't buy from you because they like you. People buy from those that like them. So if you go and find something that you love about them, or even if you can't connect on a level where it's like a really deep connection because you're like brothers, but it's like, I love your case. That's like my last ditch effort. It's like, you know what? I may not like this person as much, but you know what? I love the fact that you have bone right here. And I love the fact that it's a simple case or it's a complex case. I try to find something in the case that's like, oh, this would be really simple, easy to teach. I could video it. And you know what? You're special to me because I see how this would fit for me, be a win-win, right? So it's like just making them feel like they fit into some importance in your life. The fourth thing is why now? This is where we suck at as doctors. Because John, because we're good at what we do. And so usually we don't struggle getting patients. And so we don't push this and we just let our staff do it, right? It's just like, okay, now do the calls and the follow-ups and everything. And so I feel like, I always, and this is something I still am not good at. I still try, because I always want to be like, when the time's right, but I always say because number 4 goes to number 5, and that is, how are you going to overcome my biggest objection? Meaning that if we know going into it that finances are going to be an issue, we should have found that out on the phone call. We should have found that out when a consultation person went in there. We should know them enough that we know that's our biggest objection, and we got to find a reason why we can overcome it. And if we know the why, like this is important. If you struggle with this your whole life, there's 3 things, and I swear I'll be quiet after this, John. But there's 3 things. I just love this stuff so much, and you probably know them. But dude, I love it. There's 3 areas if you focus on, it's proven that it hits home to people. One is if you can tie whatever pain they're having to their relationship or relationships, if you can tie it to their career or making money, or if you can tie it to their health. Those are the 3 things that if you can tie the dentistry to. In other words, when they say, I don't like my smile, it's like, okay, now I'm going to say, okay, how do I don't like their smile, to how is that showing up in your relationship? How is that showing up in your career? Do you feel like it's holding you back? How's that showing up in your health? Do you feel like you just don't have the energy? Because those 3 things are so important, like to everyone in the world. And then you stay there in the pain and let them talk about it. Because usually if you're like me, I'm just like, let's get over to the good stuff. I'm going to tell you how I'm going to give you the best smile. But if you're the best doctors and the best treatment coordinators are the ones that are willing to stay in that spot where you let them talk about the pain. So
number 5,
okay,
number 5.
So number 4 was why now?
Why now?
And number 5 is how can you overcome my biggest objection? And like for me, so for example, if it's money, I always say I'll overcome that, because if I know going into it that their biggest thing is money, I'm already going to make sure that we've got an application in. Like one thing I noticed, I was looking at your website last night too, John, because I love you, brother. And like one of the things I think that I would do is I actually do have an online application for credit. And so we don't send it, and maybe you did, I just didn't see it, but we don't let it go to Care Credit or Green Sky or all these places. We actually want it, and you do have to make sure you're tight so you don't lose it and it's safe. But the great thing about that is you can take that credit and you can, as things come in, you can put it anywhere you want. It's yours now. All this information is yours. And the best marketing is when you are able to take someone and find out where they're at in the journey. And it's like, okay, they have no money, but guess what? Life changes. They get married, something happens. I have patients all the time come back and I saw them 3 years ago. And they're like, you're my guy. I never considered going to anyone else because I connected with them and I didn't see them as they're dirt bags, because they have dirty clothes. Like they come off the street, they're contractors. So the other thing that I'm really passionate about is identifying, are you hunting or are you farming? Do you understand that concept? Like there's some people that are ready and it's like, they just need to be bagged. Like they're asking for you to seal the deal. And there's some people like, they're just kicking the tires. They just want to know, right? If you walk into someone and you're trying to hunt them, you're going to scare the hell out of them. But if you walk in and you know that, like, listen, their credit's not good. They're going through a divorce right now. They don't have really any ways. The way I come in is different. It's not like, okay, let's try to get you scheduled for surgery. It's, listen, I don't want you to give up. Like, I don't want you to give up. And my message is, you can do this. I believe in you, and we're going to continue to work with you. Do you want us to work with you? Do you want us to continue to find ways and avenues? And they say yes. It's like, great. Now I put them into that pot where we just have the permission now to follow up with them, because that's the hardest thing, right? People don't want to be followed up, but if they basically say, please follow up with me, I'm telling you, in a matter of a year or two, everybody's finances change. Everybody's life changes, and dentistry never gets better when nothing's done, right? Pain gets worse, emotional gets worse. And it's like, you think about all this time your staff spends in this 1 hour consultation, and it's like, and then you let them go. So it's like, we have to keep them and continue to farm them and add. And how you farm is you continue to add value. You send them videos and you send them these gifts, you know, and you know, they don't have to be expensive gifts. I'm saying, like, for me, it's an email that says, hey, hi, I'm Dr. Hendricks. If you're on this message because you elected to hear from me, you know, you want to hear some of my tips and tricks. Here's the thing, you know, and I also give them a tip. It's like, hey, this is the type of toothpaste that I like. Or what do you do when you can't afford an implant, but you have to have an extraction? This is what I do. How do you find the right doctor just to do an extraction? Like, what are the key, like, there's all these little things that you can add value to. And John, you're super smart because you actually do quite a bit of video. You don't have to make this stuff up. You can just go to YouTube and Google and you can find things people are searching for, you know?
Yeah, I think what you said is so powerful in terms of like inside the office once you finally get them in. In terms of like I wanted to talk a little bit about the website. I really think that the traditional website, as we used to do it before, really is almost like a yellow page ad. And I really think that now, like what you're doing now with funnels and really understanding where they're at and what they need, and then you can target them that way, is the new wave of things. So I haven't gone into funnels, and that's why like I looked at, like, you know, my time hop and what I've done with my practice, and I've redesigned my website so many times. I feel like it's a yellow page ad, and I'm just sort of now just make sure that my phone number is there, my staff is up to date, my address and just basic stuff are there. I really stopped investing into my website because I really think that funnels or targeted websites are really the key. But what I want to say is one of the things that's going to be huge moving forward is that you're going to get less and less patients saying yes right away.
Yeah.
And what's going to happen is that if they do say yes, and we're experiencing it now, if they do say yes, the external influences is what I once did a podcast on that. The external influence will convince them that they are not worth it.
Yes.
So let me just talk a little bit about what that means.
Yeah, man.
The external influence does not believe that they need it. Who's the external influence? Girlfriend, boyfriend, husband or wife,
Yeah.
brother or sister, uncle or aunt, daughter or son. And it has to do with the age gap. So what happens is I say, like, when my patients are like 65 to 75 years old, they've already paid everything off. They don't have any debt. They're sort of at the point where they're sick. They took care of everybody their whole life. And maybe they have a new girlfriend or a new boyfriend, and or maybe they're recently widowed or recently divorced, or they're doing something new in their life where they finally want to live. And they've been living with this partial denture forever, and nobody knows they have a partial denture or a denture because they never complained, because they're so busy taking care of everybody else. So they finally say, you know what, I'm going to call this guy. They call, they come in, you do everything that you said to do. You give them an amazing experience, but because their whole life has been programmed to take care of everybody else, they want to make sure that they have the approval of their external influence. Now, the external influence, although it's related to you and they say that they love you, I can tell you that 70 to 80% of the time really doesn't have your dental health in mind. Because they're like, hey, what's wrong with the denture? You don't have a denture. You don't know what it is to live. And those people that have that, they don't have the ability to stand for themselves. So what happens is everything that you did to make them safe. Do you know me? Am I important? Why now? How can I overcome my objection? You did everything that you did. But in 1 second, the external influence will shut it down. So now, we now to have strategies in place to overcome the external influence, because the external influence is way higher than you on the trust, on what I call the trust factor, right? On the totem pole is so much higher that you will never win unless you have strategies intact. So one of the things that we ask is there someone, when they're making an appointment, is there someone in your life that can help you make this decision?
Mm-hmm.
Yeah, my husband, yeah, my sister, yeah, my child, my daughter. So I said, you know what? Let's bring her into that appointment. The problem is that we're trying to minimize the amount of people. So you can try and this is not going to be long term. I think I said on my previous live, it's going to be for 60 days. And During that time, you have to figure out to bring that person in. And you know what? Sometimes that person needs to be made more important than the patient, because the patient themselves can't even make the decision. And you're so dying to help this patient. And that's the thing. We want to help these people, because when we see disease and we finally have the cure, it's like, why don't you want the cure? I can change your, I know I can guarantee change. It's not like, well, maybe this prosthetic may, like, you know, your prosthetic leg. Should I amputate? Should I not amputate? Is it going to be as good? Is it not going to? We know that with the dentistry that we can create with full mouth, Excel, all-on-4 implant restorations that are done correctly, you change a person's life in a good way every time, correct?
Absolutely.
So like, I'm jumping out of my skin when I'm like, I want to help you. Why is 2 canines okay?
Yeah.
Why is a denture that's holding onto bacteria? People are so worried about getting sick with COVID, but your denture is like a festoon for other bacteria that can blow up your heart.
Absolutely,
So
man.
I care for you. You're safe here, like you said. I know you. And I want your daughter or your sister or your wife to know you too, like we know you. So let's invite her for it. Maybe we can do a FaceTime consult between the both of you.
Absolutely. You know, and that's where I think that we have to pivot, John, is because now we're not having them come in with their family yet, but having a virtual FaceTime consultation. And I actually used to have my office, my treatment coordinator do these without me, but I'm doing them. One thing that I read that I thought was really impressive by, I think it was Ray Dalio, one of the smartest guys out there, may not have been him, I'm not sure. But he said now is the time to do things that you wouldn't normally do, because normally we think of things like, I can't do that because I can't scale it, right? In other words, like I can, for example, like when I first started my practice, like you probably did things that were very like over the top awesome. Like I would answer the phone, right? And be like, hey, I'm Dr. Hendricks. Please come see me. I have no experience, but I'm a really nice guy, you know? And, but like, one of those things I was thinking about, it's like for consultations now, right? Like something that I haven't done yet, but something I wrote down to do was like every time I get a consultation now, I actually want to call them before and say, listen, most people, I know you, and most people get really nervous about coming to the dentist. I just want you to know that you're actually talking to the doctor who's going to see you. I love what I do. You're not going to be hurt. I'm not going to even have an instrument in your mouth. All we're going to do is sit down and have a conversation about what's going on in your life and give you some options to be able to help you find whatever you're needing, you know? And is it okay if I send you a video that tells a little bit about me and my staff, right? Permission. And they say, oh, that'd be great. Now you send them a video that basically is awesome. It's off of YouTube. And it basically just, when everything's controlled, you're able to get your message out, you know? And so I think that it's breaking down those barriers that they have. Like you said, it's just because the influences out there they're really strong. I agree. Like, and they're going to get stronger. And every time they get shamed, right? How could you spend that? And this time in this economy. So so in my mind, I'm thinking, okay, how do I overcome that belief? Because really it's a belief system. There's a belief system. One of my mentors, I love him. I crush on him too, just like I've crushed on you in the past. There's certain people, it's like, John's freaking amazing in digital. Russell Brunson, he's like Mr. ClickFunnels, right? And the way he sees it is every person that comes into your sphere, they have limiting beliefs. And it's like, what are the limiting beliefs? It's that obstacle, like number 4 I was telling you about. What's the biggest domino belief I got to knock over? That if I knock that one over, it's going to knock down the next domino and the next one. And it's not the same for everyone. Like some people, you think it's always going to be price, but you know as well as I have, people come in and they're terrified. They're shaking. It's like, how much pain am I going to be in? So the big domino for some people is how much pain, when can I get back to work? How much time is it going to be? It's because we call it chief complaint. What's your chief complaint, right? But I will tell you, what people tell is their chief complaint and what the truth is, totally different things. Men are biggest liars in the world. They're never going to say, I don't like the way I feel. I feel inadequate. No, we don't do that, especially a man to a man. We don't say those things. So that's where we have to keep on asking questions. But if I look at my consultations, the first 15, 20 minutes is all about those first three. Do I feel safe? Do they know me? Am I important to them? And if I do those three things, at some point, I'm going to break through that barrier, and my heart, because see, I've been trained as a dentist to think logically. That's our superhero force. So I try to think logically, like, why wouldn't you want to take care of this problem? It's a great time. But what really people, John, you get this too. It's not a logical decision. It's emotional. So it's like, that's why I was telling you, the best people that I think, the dentists that are going to do the best during this next 6 months are ones that are willing to be vulnerable enough and talk from the heart and be like, I'm going to share stuff. Like I'll do things in consultations, like I'll break a pattern. Like, and it's another word that I love too, that breaking patterns in patients. So sometimes there's patients that come in and they're just like, that you can't crack them. They're just so tight. And so what I have to do sometimes is I'll be like, okay, I either got to make them laugh, I got to make them cry. And sometimes it's like, okay, I'm going to tell them my most vulnerable thing. What is it? Like for me, I'll tell people like, you know what? I burned out 3 years ago. Literally, I cared so much about dentistry and I was wearing it so much. I was taking it home. Like literally, I didn't know if I wanted to be a dentist. And like sharing that with someone is really vulnerable because they're like, wow, you didn't want to be a dentist. But then I went on this journey and I realized that for me, it's just like you are in this journey right now. You're having this pain. I realized I had to make some big decisions in my life to get the pain out of my life. And so like it relates to them too. But the vulnerability is sometimes I will get emotional. And I'm telling you, and again, it can't be fake. If you're trying, it's too, but I'm telling you, that's, I really believe like if the people that are willing to be vulnerable are the ones that are going to sell and they're going to connect with patients.
Yeah. I can tell you that, even, the hardest people to talk to are dentists. And you and I both, we teach what we love to our colleagues. And one of the first things that I do, and I'm sure you do the exact same thing, before I even start, is I'm vulnerable with them. And I tell them, listen, I'm just like you. I practice every single day. I still have all the challenges that you have. And I failed. And I show my failures over and over and over, whether it's in management, whether it's clinically, whether it's personally, we talk about it. And it allows you to connect to the dentists in the room that are, their arms are crossed where they're closed. And a patient, we get into body language. A patient that is closed, is not really going to listen to us. I will say to you that, just as a side note, our live is a little bit off, but I recorded the whole thing, so I'm going to repost it.
Okay.
The Facebook Live is just acting crazy, so we have about 12 more minutes, and then I'll post the whole thing on Facebook and tag that we have. It's just the live keeps on going in and out, but I recorded the whole thing. But essentially, in terms of body language is everything, and really getting through to your patient to really make. I think you talk about hitting a nail on the head. Those 5 things that you talked about is so true, and it had nothing to do with dentistry.
Yeah.
And that's the thing, like when they called you, or they call me, they have some level of trust. They figure you're a dentist, I saw something that really made me trust you. Now I need to know if those following 5 things are there. And they don't even know that's what they're looking for. But that's what will allow them to say, you know what, I trust this guy to either pull all my teeth, to reconstruct me, to live with something the rest of my life, that he or she is going to have an impact on me. Mm-hmm. And I just think I want to talk back about when I said in the beginning about 45 minutes ago, it's back to basics. We have to start talking like humans again. Yeah. And connect. And now, especially in the time of COVID and quarantine and social distancing, we're more alone than we've ever been before. Mm-hmm. And people are alone. And we get people calling our office just to talk because they got nobody. Most people are alone. Not a lot of people have large families, or most of the people are alone, especially, New York, New Jersey. People live alone. They live in studio apartments. They live by themselves. If they're older, they live by themselves, and they just want someone that's going to listen to them. And then once you open the lid, they can't stop. Like you said, once the lid is open, I'm like, It's the best thing in the world, because now you actually have a captive audience that's listening to why you really have their best interest in mind. And I think that's so powerful.
I think it's one of your strengths, man, is that, with all the teaching you've done, I think you understand the struggles that people go through. It's like, what they're going to, like, the pain that they haven't felt that they're going to feel, right? It's like, you know the journey that they're going to go on because you've been on it. And it's like, that's the power of why you have so many doctors that follow you and connect with you, because you're basically giving people perspective, right? You're seeing from a higher level. And I think that if we can just be able to communicate in the same way with the same passion to our patients, really all we offer to someone is a perspective they can't find anywhere else. But if we try to jam it down their throats, instead of like offering it up on a platter and saying, I love what I do. I like you. You're safe. I know you. And now is the time. There's no other time in the world you would be better. Right now with, what's going on, like, you want to be able to make money for your family. You don't, having a smile, I can't hold you back. I mean, John, right now there's 15% unemployment, right? And that's, we're headed towards the same, it was 1929 to 1933. We're right in the middle where it was 15% unemployment. And so we went there in like a month and a half. And so the chances are that we're headed towards depression. I'm not trying to doomsday, but it's a very good chance. And if that's the case, that means we're going to reach probably upward 25% unemployment. That means 25% of our patients aren't going to have insurance. So that means they're going to be searching for dentists. If their insurance isn't telling them where to go, guess what? They're going to look on Google, they're going to go on YouTube, and they're going to find a John Abenaim that's talking their language, that's speaking to them. And so the thing like I see is 25% of the population is going to be up for, I'm going to take them. I mean, I'm going to take, because and it's because of the way I'm going to communicate. So.
I love it. So what's some parting words that you would tell a dentist in terms of they're going to go back as everything is about to reopen? We're April 29th, 2020 now. And I'm going to rewatch this video in about 2 months. And I'd love to see where we're at and what we said if we implemented it. I mean, for me, the most important thing is I'd say, like I said in the beginning, go back to basics, start listening to people. Most importantly, not just listen to your patients, but the people that are the most important one of the most important people to listen to now is your team.
Yeah.
Because they are also really scared. And some are more scared than others. But now's the time to really, and I was vulnerable that way this week myself, with my own teammates. And the fact that listen to their fears. Don't just say like that, but listen to them and address it. Again, if some of it is not based in fact and it's just an emotion, like, let's discuss it. Let's discuss how we can get to where we need to be and how we're going to get to get the result that we both want. If the result is to just be afraid, stay home and lock yourself up, that's the end result that you want, then that's okay. That's what you want to do. But if we both really want to find a way to get to where we're both safe and you're doing your job and I'm doing my job and I'm helping people and you're helping people, then let's discuss, maybe we can do things that are different that we didn't do before. In terms of your patient, maybe it's about, maybe doing 2 consults, maybe really finding a way to bring the external influence in if there is one, maybe really figuring out a way, an alternative treatment plan for them that maybe now is going to work for them that didn't work before, and then in a couple of months they can do something different. But importantly, to listen to the patient, to say that if they say no, it doesn't mean no, never, but maybe no, not now.
Yeah.
I love no, not now, because that means I still got them and they trust me. They're just not ready.
Absolutely. Powerful words, man. Wrote down a lot of that. It's good stuff. My parting words would be, I think no one's going to save us. Like, sometimes we are lazy and we think that our team's going to bail us out, or right now it's the government's telling everyone, we got you. Well, that's going to dry up eventually. It's just impossible for us. And so we have to own it and do not shut off marketing. Like that's going to be your instinct, is to shut down marketing. And that would be the worst mistake. Now is the time where you just refine your marketing. You do not adjust your budget. You whatever you've been spending, You should at least spend that. I'm increasing my budget, but my messages that are going out are now going to be more tailored. And lastly, I just want to make this one little thing that, John, you're like, you get these doctors to spend lots of their time and money, resources to do digital. And here's the way I see it. We are doctors. They are so, for some reason, for them to go spend a ton of time in CAD and a ton of time in all these things, it seems natural for them. But to learn marketing, to understand ROIs, to understand how to place a Facebook ad, understanding, like, I think that again, the doctors that are going to do the best are the ones that know how to connect with their patients, and the ones that don't go back and think they're going to turn the button on and do the same thing. They're the ones that are looking at the world differently. Like I said, Dream Dental died in March, and the new Dream Dental's just barely opened up. And we have to be able to adapt. The ones that don't adapt are truly the ones that will, I don't know if they're going to go out of business, but they will suffer. They will suffer to a level, and they'll lose their team. And the next 3 years could be the hardest 3 years. But the ones that say, you know what, I'm going to adapt now. I'm not going to hesitate. I'm not going to let the fear. I'm going to reach out and find mentors like John to help me in this place here. I'm going to find a mentor, a leader, whatever I need. If it's communication, if you have this problem in communicating, I'm going to go find a coach. Teach me how to talk. Like, how do I get someone to how do I get my barriers down so I can just be human? Like, go get a coach, man. Like, learn how to talk, because I'm telling you, marketing and sales is nothing more than just one word: communication. And we have not been taught as men and as dentists how to effectively communicate, and that's why many of us will struggle. So there you go.
All right. Well, until then, if you guys are watching this, I appreciate the time, and I hope that it'll be helpful. And I hope that in 30 days, you guys will be even better than you are now. And maybe we'll reconvene in 30 days, see where we're at, and we'll go from there. Have an amazing day. Love you too.
All right, buddy.
Let me just stop the recording.